in this field. I finished my post graduation in 2009, and henceforth I've been in clinical practice. So I specialize in high risk pregnancies, fertility care. I have done my fellowship in laparoscopy, infertility, and cosmetic gynecology. So I have been attached with medical college practice for more than a decade, and since last 2 years I have started full-time private practice. I have put up my clinic, which is called as the FemMed Clinic. We are located in Chennai at Porur, and we function all through the week. So we provide holistic women health care for almost all women related issues. So we have a whole bunch of patients, pregnant and non-pregnant, who walk into the clinic on an everyday basis. And we offer solutions for all women need, starting from pre-puberty, puberty, during the reproductive age group, during pregnancy, and menopause. So this session, which is planned now, we will be talking about nutrition in pregnancy. That is the topic given to me, and I am very glad to be discussing this particular topic because I sincerely consider that this nutrition as a big lacuna in our part of the world. It is quite saddening to know that almost more than 30% of Indian women are identified with anemia at some point of time during their pregnancy. So basically, it denotes two things. One, the pre-pregnant age group women, that even before pregnancy, women health is neglected, is one. And the other important observation to be noted is women are during pregnancy, most of the time they either are completely ignorant about what has to be taken, and in the other spectrum we have women who do not have the facility to procure nutritious food. Both are to be condemned, and nutrition, which is supposed to be given to every other individual, which is a basic human right, should be the same for a pregnant woman, should be more so for a pregnant woman rather. Okay, there is a wide range of misconception and myth associated with nutrition in pregnancy, which also will be discussed during this discussion. So the first thing that I want to put across and I want to clarify, when we talk about nutrition in pregnancy, we are talking about the additional requirement which is required during the pregnant period. But we should not forget that nutrition is important in a woman's life all through. Okay, so whenever, whether you are pregnant or you're not pregnant, you should always make sure that whatever you're eating, your intake of food is always having a good amount of nutrition in it. We are concerned and we are specifically talking about pregnancy because when there is a nutrition deficiency during pregnancy, obviously we are having two members who are undergoing the pregnancy experience. It is the mother and the fetus. So the effects of this lack of nutrition can affect the mother in many ways, and it can also affect the fetus. I again want you to understand about what I just now told you. I told you nutrition deficiency can affect the mother in many ways, whereas it can affect the fetus also. This is the statement I made. From this, I want you to understand that the women is more affected than the fetus in the event of a nutrition deficiency. Yes, the physiology is so beautifully built. The fetus, which is growing inside the womb of a mother, is going to be feeding on the iron stores or vitamin stores or the calcium stores which the women has cultivated over a period of years. Okay, so whether I'm taking calcium or iron today or not really does not matter to the baby which is inside. Whether I eat enough of nutrition or not, the baby is not bothered. The baby will keep feeding on the stores which are already made by you. Okay, so what will happen at the end of the day? It is like a bank robbery. Okay, so you have been over a period of long years, you have been taking nutritious food and you have been saving some for your stressful period. Okay, just like how we keep putting in money in the bank, you have been slowly building up your nutrition over the years, and now we have this tiny weeny little fellow sitting there in your tummy who is going in feeding on these stores. Okay, so your bank is getting robbed. So who is going to be the loser there? Obviously it is not the baby. Okay, so it is going to be your health which will be jeopardized if you are not concentrating on the nutrition during pregnancy. It is very very important, because you once you go through and complete this period of pregnancy of nine months, following that you have a whole lot of life that has to be led in a healthy manner. Even if you have to provide enough to the baby which is going to be born, you need to be healthy. So for your health, for the well-being of your baby, for the well-being of your family, it is very very vital that you are aware about what to eat, how much to eat, what is good to eat during your pregnancy. So this is what we are going to be discussing. And one another important myth I want to burst right now in the beginning of this session is that there is a common, understanding among people that when pregnant, you are eating for two. So you should be consuming everything double the quantity, more food, more sweets, more fruits, whatever you are taking has to be like double the quantity, because you have to have satisfaction, and the baby also should be having satisfaction of the food. I do not think it is correct for us to be doing such a practice. Okay, just if you can recollect what I just now told you, your job during pregnancy is to take care of your health. If you're taking care of your health, you are indirectly doing a lot of good to the baby. So you need to continue to take care of your nutrition, and you need to continue to eat for only yourself. The baby will take care of itself. That is the beauty of nature. Okay, so whether you eat to eat today or not does not matter to the baby. Okay, whether you are eating for 2 or 3 or 4 does not matter to the baby. The baby in the womb will be feeding only on the stores which you have made over the years. Okay, today for example, let me put it this way for you. If you are going to eat 2 packets of biryani today, it will not go and reach your baby's tummy today. Okay, in contrast, whatever nutritious food you have eaten in the past, maybe over like 2 or 3 years ahead, if your nutrition has to be good at that point of time, that will actually benefit your baby now. You're understanding? So please do not indulge in having this practice of eating for two, because you need to be aware that the allowed weight gain during pregnancy for a healthy pregnancy is only between 10 to 12 kgs. Fine. So out of this 10 to 12 kgs, your baby is going to take a couple of kgs, and then you have the placenta, you have the amniotic fluid, that is the water which is surrounding the baby. So all these will take some amount of kgs. So you will be left with an limitation of only around 7 to 8 kilos that you can gain. So if you start eating for two for the entire 9 months period, it will not be a healthy weight gain, and you will not be able to stick on to this limit of 12 kilos of weight gain during pregnancy. And many people, the minute they turn pregnant, and even in the first or second visit, second checkup, they come and meet us, they start worrying, doctor, why there is no weight gain? Is my baby growing fine? Why my weight is the same? Okay, so I want to stress here that in the first 3 months of pregnancy, we do not expect weight gain at all. Okay. Moreover, some women who are having hyperemesis gravidarum, that is excessive vomiting during pregnancy, can even lose weight during the initial first 3 months, which is absolutely normal. So weight gain usually happens only after this 3 months period. So typically it is between this, beyond 5 months is the time we expect the women to gain weight. So do not panic or do not get worried that your weight gain is not adequate in the first half of pregnancy. And if you are not gaining weight during the first half of the pregnancy, it is absolutely normal. Please understand that. So, how much weight gain is normal and how you can plan it is what we have told you now. So, the normal weight gain is between 10 to 12 kilos. So, your weight gain, you should be focusing not in the first half of the pregnancy, but in the second half of pregnancy. Okay, so this is what is normal. Fine. So, how you can eat, what food can do good to you and the baby? This will be discussed in the second half of this discussion. So I would like to divide this into first trimester, second trimester, and third trimester for you to understand better. First trimester, I mean the first 3 months of the pregnancy. So first 3 months of pregnancy, what you can be eating and what you should not be eating. Please note, the first 3 months of pregnancy is, it is kind of the most difficult period for most of the pregnant women. Why? Because this is the time you are newly exposed to this pregnancy hormone called serum beta HCG. So, all the effects of these hormones you are experiencing for the first time. If you are a primary gravida, whether if you're a first time mother, you will be experiencing this hormone for the very first time in your life. So, your body will start reacting to it. You may feel weak, you may feel dizzy, you may feel sleepy, you may feel nausea, you may start vomiting. All these are effects of your pregnancy hormone, which is absolutely normal. Okay, that is why we always insist and tell, having a vomiting 1 or 2 times in a day during pregnancy in the early half, that is in the first 3 months, is absolutely normal. So when you have to worry about your vomiting in pregnancy is only when you are not able to do your day-to-day activity, or if you find your urine output is decreasing, or if you are finding that you're feeling dizzy, your BP is falling low. Only in such specific conditions we normally treat vomiting in pregnancy. Just 1 or 2 episodes of vomiting in pregnancy is normal and you need not treat it. Why am I talking about vomiting in detail so much is because I want you to understand that you should not be concentrating on eating a lot during this first 3 months of pregnancy, because you are going to have a tendency to vomit. So if you start eating protein rich food, very hard to digest substances, there is going to be difficulty. You may end up having chest burns, heart burns, and you may end up having a little bit excess of nausea and vomiting, which we do not want. So what is advisable is to stick on to having natural food, whatever is available at home. Completely avoid tinned or canned or packet food, because they do have preservative which kind of increases the acidity in the food and it will end up having heartburns. So kind of stick on to what is available in your kitchen. That's number one. go have food as natural as possible, and try to eat things which are easily digestible. So this way you can keep your nausea, vomiting, and other discomforts to the minimum. Okay, and this is what you should be concentrating on the first 3 months. Okay, you can have a liberal amount of fruits and vegetables and nuts. If you are already used to having nuts, you can continue eating that. Otherwise, please do not start having nuts for the very first time during the first 3 months. Okay, other than this, food to avoid in modern medicine, there is no particular recipe, there is no particular food which we say that it will harm your baby directly. All natural food you are free to eat. However, there are certain family practices wherein there are beliefs that papaya or dates can, cause ill effects in pregnancy. However, modern medicine, there is no proof and there is no research to prove anything of that sort. So, all natural foods you are free to eat. There are few drugs, there are few medicines which has to be avoided. So whenever you're going for a checkup, whenever you're going and meeting your doctor to take a prescription, please inform them that you're pregnant. That is the only precaution in your first 3 months. Now going ahead about the next 3 months, that is from your third month to 6 month. So this is the time when your baby is going to actively grow. Okay, in the first 3 months, only the internal organs were growing. The brain, the liver, the heart of the baby, everything will start and complete its formation within the first 3 months. So after this 3 months is the time when your baby's muscle, bone, everything is going to grow. So obviously there will be a lot of protein demand during this time. Okay, so this is the time you need to be concentrating on taking protein. If you are planning to have any kind of protein supplements, so this is the time you should be doing it. So you can concentrate on having a handful of pulses, sprouts, and protein rich food like meat and egg white. So all these kind of supplements you can start taking in the third month to 6 month when the baby is actively growing. And if your sugars are normal, if there is no risk factor which has been intimated to you by a doctor, you can consume your regular amount of carbohydrate. You can calculate a daily calorie of somewhere between 1500 to 2000 in this period from the third month to 6th month of your pregnancy. Okay, this period, third to 6th month, is relatively a trouble free period. Most of the women have a good time during this space, so they will actually be comfortable in eating many stuff which they were not able to eat even in the first 3 months of pregnancy. So this is a good span of time to actually work on your nutrition, because you will be able to actually enjoy and have your food between this third month to 6th month. So what happens after 6 months is your tummy grows little more further. Kind of your uterus will be hitting against your stomach at this point of time beyond 6 months. So your volume of the stomach kind of may reduce. So the amount of food which you are used to eating, suddenly you may find that you're not able to eat that much food. And you may again start developing the symptoms of discomfort or heartburns, and all this is because of the growing uterus. So this is again the time when you will be having a tendency to have reduced intake. If in case that happens, understand that it is normal, and all that you have to do is that you need to space your meal. So basically what is happening is your stomach is getting compressed. So obviously the stomach is, if you try to load the tummy, you will start having discomfort. So all that you have to do is that do not load the tummy fully, don't eat stomach full, and always keep your tummy half filled, and try to space your meal. Continue to have protein rich food, concentrate on the sprouts and pulses, nuts. Okay, and this point of the time, that is between your 6 months to 9 month, is the time you need to really cut off on your carbohydrates and fat, because this is the time when your baby is going to become fat. Understood. So, as I told you, between third month to 6 month, the baby will be concentrating on developing the muscle and bone. And beyond 6 months, to as the baby is getting closer and closer to delivery, the baby will be working on developing fats, because fat is very important for a newborn baby. So the baby has to start producing fat and start developing some fat stores for itself. So the baby will be concentrating on this particular job. So at this point, if you expose yourself to a lot of carbohydrates or a lot of fatty food, the baby will end up gaining weight. So then if you are a person who is wanting to have a normal delivery, it is very important to keep your baby's weight somewhere between 2.8 to 3.2. Anytime it goes beyond this, it can get difficult for you to go through a normal vaginal delivery. So if you are a person who's keen about vaginal delivery, please keep this in mind, that as you get closer to delivery, please cut down on your carbohydrates and stick on to a protein rich food. Okay. And obviously every pregnancy needs some amount of vitamin supplementations, especially folic acid in the first 3 months of pregnancy. If you are someone who's planning your pregnancy, and during that time itself, please start your folic acid, because folic acid is best when it is taken 3 months pre-conception. That is, if you have taken folic acid for 3 months, and then if you conceive, the baby which is forming will have the 100% benefit of folic acid. So, if you have a chance, if you are someone who is planning for pregnancy, please make use of this information. Okay, so folic acid supplementation is a must during the first 3 months. Why am I insisting on this so much is that just by taking folic acid, we can reduce the risk of abortions by almost 30 to 40%, which is huge. We can omit almost like 30% of the miscarriages which can happen. So please consider and make it a practice. And whomever you meet who's planning pregnancy, or whomever you know is in the early stage of pregnancy, make sure that they are taking folic acid tablets. Okay, this is one. And as you are crossing third month, your doctor will be prescribing iron and calcium. One more point I want to insist, because this doubt many patients ask. They get worried about taking tablets in the first 3 months. So they ask, can I take naturally? You tell me some food which is rich in folic acid, I will eat that so that I can avoid tablets. You cannot do that, darlings, because folic acid is found in a lot of green vegetables. But the thing is, you should be eating them raw. You should be eating tons and tons of raw vegetables for you to get that 5 mg of folic acid per day, which is practically not possible. And that is the reason folic acid is being prescribed. So please take your folic acid tablets without fail. Moving on to the next supplementation, which is a must during pregnancy, is your iron tablet and your calcium tablet. Iron, as I told you, anemia is almost like rampant in India. So it is very important that you either correct your anemia if it is present before planning pregnancy, or if you are diagnosed with anemia during your pregnancy, please go by your doctor's advice and get it corrected as early as possible. Okay. And during pregnancy, there is an expected fall in the hemoglobin of almost 2 grams, which is normal. So you need to have a good amount of iron rich food, and you need to supplement iron for your body to cope up with this 2 gram of fall. If you fail to do that, if this 2 gram of fall is not well compensated, there can be side effects, or there can be anemia related complications, which is really not warranted. And so just simply tossing in an iron tablet will do a lot of good to you and the baby. And about iron tablets, one more thing I would want to tell is that there can be few women who are not able to tolerate iron tablets. They may start having heartburns, they may start having nausea and vomiting, they may just feel uncomfortable, they may have constipation with iron tablets. So if you are experiencing any of these symptoms, All that you have to do is meet your doctor and express your discomfort to her so that she can change the iron molecule. We have so many iron molecules, and each molecules we have like different formulations from different companies. So maybe we can change your molecule to some other molecule and give. So only that has to be done, and stopping your iron is not an answer. Whatever the discomfort you're undergoing, please express it to your doctor. This is one. And the next supplementation that you will be asked to take is your calcium supplementation. This again is very important. So we are again going back to the very first point which I told you, wherein you need to understand that your baby will be feeding on your stores. So if your calcium intake is not adequate, and if there is going to be a calcium deficiency, what happens is your blood will start absorbing the calcium which is present in your bones. Okay, so as a result of this, what happens, your bones will start getting weakened. So this is the common reason that many women will start complaining of low back pain during the later half of pregnancy or immediately after delivery. Okay, so make sure you are continuing to have your calcium supplementation during pregnancy, and remember that you need to supplement yourself with calcium till you are breastfeeding, how much ever time that is. If you're going to breastfeed for 1 year or 2 year, make sure you're continuing to have your calcium supplementation during this time. So other than these three supplementation which we just now discussed, that is your folic acid, iron and calcium, these three are mandatory. Other than these, whatever is being prescribed, it could be a vitamin D or vitamin E, or it could be a protein supplement. All these things are optional, and you can leave the other supplementation to your doctor's discretion. But remember, these three supplementations are absolutely mandatory during pregnancy. So I hope I have covered like most of the common doubts. So just check if you have posted any queries for me to answer. Okay, somebody is asked about workout. Okay, we have been talking about nutrition. So that is the reason I did not, I did not really elaborate about workout. Workout is one thing that you can continue to do during pregnancy if you are used to it. If you are a person who's newly going to start workout, please do it with guidance. You can do either physiotherapy or yoga. It is according to your comfort zone. You can do whichever you want. But if you are starting it anew during your pregnancy, please do it under supervision with proper guidance. What are the nutrition needs of a pregnant woman? Isha, that is what we've been discussing all the while. We have been, the nutrition needs are, you need all the vitamins are required. You need to have an iron rich food. You need to have a protein rich food. Whenever I say iron rich food, the good sources of iron are drumstick leaves, dates, pomegranate, beetroot. So all these are good sources of iron. So, and if you're a non-vegetarian, you can also include liver, at least weekly once, and you can have this cultivate this practice of taking your iron tablet. The water which you are swallowing to what water which you are using to swallow your iron tablet, na, try to add a dash of lemon into it, not sugar. Okay, do not make it into a lemon juice, just water with a few drops of lemon. Use that water to swallow your iron tablet. It will, this vitamin C will kind of help in better absorption of your iron which is present in your iron tablet. And do not take your iron pills immediately after your meal, and space it at least like 40 minutes after your meal. And do not combine your iron tablet with any dairy products. So these are the things you can do about your iron. And the other thing is protein. As I already told you, you can add a good amount of sprouts every day, egg whites every day, soya, paneer, all these are good sources of protein. Okay, so you can, if you're having any further queries, please free to post them in the Baby Chakra app, and you can follow me in the app. You are using the referral code Divya Diviya. So we shall stay connected, and any queries which are coming up in the app will also be answered.